I am a Reiki practitioner, which is an energy healing type of work modality. I also am a spiritual and a grief mentor, and I do motivational speaking as well. Well, grief is very individualized. It is strictly who you are and how you handle that loss in your life. If someone gets stuck in a certain stage or area of grief, then we might have to delve a little bit deeper into how we can get them through the grief process. People can come to me in crisis or just in times of feeling like there's a next step, but they don't know what that step is. And so through just talking with each other and working through perhaps some issues, then I am able to encourage them to take the steps necessary to become who they were created to become. With mentoring, the way I look at it, I become more of an advocate and an encourager to listen and to believe in the person and perhaps offer just a little guidance now and again to get them on a track that is beneficial for them and their life purpose. Most of the time, I would say it's because there's an individual situation that they are coming to me with. But once the story is told, we start unpeeling the layers and trying to find out, why did you make this choice? Why did you find yourself in this situation? And then hopefully when we do that, then we work on the solution as opposed to just talking about the problem. And the solution isn't always a cut and dried situation. Oftentimes the solution means we have to look at family issues, family of origin issues especially, and then we just continue to work and bring them to a place of belief in themselves, and that all of these things happen for a purpose, and that now what do we do with this information that we have discovered, and how can we go forward and move forward in our lives to become better people and not keep making the same mistakes over and over again, to learn the lessons that we've been brought here to learn. A family of origin issue could be, especially for males, they might have issues with their dad and the way they were raised, or with women, it tends to be a mom thing. Mothers and daughters have issues sometimes, and sometimes with siblings as well, maybe even grandparents. It sort of depends upon the individual family and how you were raised and how interconnected you were. One family of origin issue that comes to mind right away is alcoholism, because it really is a family disease, and everyone in the family is affected, but everyone in the family is affected differently, whether you be the actual alcoholic or you be a product of that alcoholic home. That's not my job as far as I'm concerned. As getting someone else to stop drinking is not something that I am capable of doing. That has to come from the actual individual and their desire to do that. I would be happy to work with anyone. I am a product of a 12-step work. I have done a lot of AA, Al-Anon, adult children of alcoholic work myself. And so if someone came to me with those issues, I would certainly be recommending them to pursue the help that is available in the 12-step work. But I also am blessed to know a few of the counselors in this community, and so then I would refer. If it was something that I did not feel I was capable of handling, or if it was a little bit deeper than what I needed to go with this client, then I would certainly be recommending that they would see someone else. That's what I can be, is someone who will listen. But then as a mentor, I can guide the conversation to the hard stuff. That is, what is the worst that can happen? What can any of us do to help you through this process? Any of those kind of questions that can be helpful in just guiding them to that place of acceptance, and then to the place of, now that we have this diagnosis, what do we do about it? And how can we be a help to the family members and to the actual patient themselves? Because end of life or any kind of critical diagnosis is a huge trauma, and you actually go through a grieving process when you get that, whether it be you personally getting that diagnosis or a family member, and you need to process that, and that's what a mentor can help you do. That's what I could help you do as a mentor. And Reiki for me is a beautiful way to reduce stress. And most folks who come to me then, of course, are under stressful situations. So it's a great opportunity for me to be able to do both for my clients. Massage is very much a hands-on, and the kneading of the muscles and the anatomy is involved. And I'm not a massage therapist, so I can't go into great detail. But Reiki is more a energy healing. It is a hands-on. And that being said, there are 7 energy bundles in each and every individual's body, and they are called chakras. And we have 7 of them, and I will, when I'm in a Reiki session with a client, I will lay my hands on those particular chakras in the areas. And then for me, it is a matter of just thinking good thoughts and praying for my client and praying for healing, and just going down the chakras and other areas of the individual's body, and just letting the energy work and kind of clearing some blocks that we've got. I'm a believer in cell memory, and I think there's a lot of things that have happened to all of us in our lives that have been quite traumatic, and energy work can help to release some of that and to bring us to a more holistic, healthy way of living our lives and releasing some of those blocks. There's a chakra on the top of your head, that is chakra number 7. Mm-hmm. There is a chakra in between in your eyes, sort of, and your forehead, and that is chakra number 6. And chakra number 5 is your throat. Chakra number 4 is your heart. Number 3 is your solar plexus. Number 2 is just below the belly button. And number 1 is kind of on the end of your tailbone. When you receive a Reiki session, you will be laying on a massage table, and a typical Reiki session lasts approximately 1 hour. Although I do chair Reiki, and I can accommodate any time limit on that. But if you want a full session, that is 60 minutes approximately. And yes, my hands are being laid on the chakras, and if someone comes to me with some shoulder issues, then I will lay my hands on the shoulder or any other area of the body that is appropriate, and I will work and just try and bring good healing energy to that area. I do not do any kind of massage or actually even moving of my hand. I just lay my hand typically in that area, unless I really feel called to do a little bit more which is very rare, but most of the time it's just a matter of my placing my hands over a spot on the body and just thinking good, healing, praying thoughts. And there's just so many wonderful things about Reiki, and the studies are showing that Reiki is very beneficial for those who are transitioning from this life into the next, if you believe that. I do believe in another life after this one, and so I've actually been privileged to help 2 people transition into the next life. And also it's being studied that clients who have Reiki also accept chemotherapy into their bodies better with less side effects. And so that, to me, it would be a very beneficial thing. I also have had a couple of clients who have come to me who are just about ready for surgery, and I've been able to work with them and do Reiki sessions, and their recovery has been very swift. And so that is just a great blessing for the client, but also for myself. It would be different for an 86-year-old client who is lived their full life, and this is a diagnosis. Yes, it's troubling, but it's perhaps their time. On the other hand, when you get a diagnosis as a young child or a teenager or a young adult, it's an entirely different mentoring system as to working through and helping someone work through those very difficult choices. And the Reiki can help just bring a sense of calm and peace into the spirit, and therefore bringing the mind, body, and spirit all together, connected to bring about healing. And just a reminder to not confuse healing with a cure. We all want that cure, but healing can be way different than a cure, and there can be a wonderful sense of health restored even if the body does not get well. Yes, they can call anytime, and they may not know exactly what type of appointment they want to schedule right away. And so my suggestion is always then, well, let's meet, let's talk, let's get to know each other a little bit and see what is going to work best, or if it's a combination of all of the things that I work with.